Hello, good morning, everybody, to our sixth Job to be Done webinar on jobs to be done and outcome-driven innovation. Today, with a special topic, business model innovation based on job to be done thinking. I will wait a few seconds until everybody has joined from the waiting room, and then we really go into it. Now, for the time being, for everybody of you in the innovation community, for all of these innovators out there, you probably have realized situations where you see that a product innovation or a service innovation is just not enough. Where you see a situation where you have an idea to create more value to people, but you see it's not possible to do this within the existing scope of a business. And very often these are the more radical ideas, the more radical approaches to create value, to innovate. And this is exactly the topic of today's webinar, where we would like to have a look at how to deal with such situations when a product or service innovation is just not enough. The guiding question for today, how to innovate a business. Now, before we want to jump into ideation on how to innovate the business, before we can start innovating, it's always good to better know the animal and to describe that. And therefore, I have brought here a structure that is very useful for innovation of a business, and that's the business model canvas that probably many of you already know. So what I will do now is I will introduce you very briefly to this structure of a business model, because these are the elements where we then want to start innovating. Now, these are 9 building blocks, and they are interacting with each other. The first block, customer segments, describes who is the customer and what is the unmet need. Are there different segments in the market? The most central building block of a business model describes the value proposition, and that is the bundle of products and services that create value for a customer segment. The channels describe communication and delivery of value proposition customer segments. And customer relationships describe the types of relationships a company establishes with specific customer segments. Revenue streams is pretty much clear. It's the cash a company generates from each customer segment. Key resources, the most important assets required to make a business model work, and the key activities are the most important things a company must do to make its business model work. And then we have the key partners, very important when it comes to the innovation ecosystem, and very important when you want to set up new businesses that you probably have not been in so far. It's very important to consider taking in strategic key partners, the network of suppliers and other partners that make the business model work. Yes, and finally, there will also be a cost structure in a business and all the costs to operate the business model. Together with the revenues, they define the profit formula. So now we have the structure in place, and basically what we can do now is we can innovate in each of those elements. And you can probably change each of these 9 building blocks. But what you will realize very fast and very quickly is that the most central point of it, the value proposition, is really linked to everything else. And the value proposition is the most critical factor for business model innovation. You can also see that there is a lot of discussion about how to designing a value proposition. And there are books out there on that. And this is also what I want to focus on now when it comes to business model innovation. And I want to do that together with a real case example out of the medical industry, the medical device industry. And that is about innovating the blood sugar meter business. You have a picture for that as well. You do not need to be an expert for blood sugar meters. What it is all about, it's about diabetics who want to measure their blood sugars. And for that, they have blood sugar meters. Now, this is a typical question that you may be challenged with in your innovation, in your organizations. And I would like to test this out and see what pops up into our minds when we get this kind of question on the table, and how we could probably approach that. Now, please go ahead, give us your quote, and start the discussion on this. There's also the possibility to put in your questions from in our Q&A mode, and we will also go into that. Now, what about the results of our voting here? I'm pretty much curious what you found out. Build a diabetes app, make blood sugar meter production more efficient, offer a digital customer service, find new online sales channels, find a startup that disrupts the diabetes market. Okay. Let's have a look at the results. Okay, so we can see here, building a diabetes app is pretty much the favorite here. Another one would be to offer digital customer service. And last but not least, find a startup that disrupts the diabetes market. Now, these are all valid approaches, definitely. The trickiest thing is, which would be the right one? What is the right approach here? And how can we ensure that we probably have not missed anything out in the category of others, because probably we could have done even totally different things than that. And we want to also be a little bit more precise. So let me see how we can approach that challenge here with that business model canvas that we have just seen. Now, what we can do, and that is a good starting point, is to map out the existing business model in that business model canvas and put in all the elements that are already there. So if you are in a market already, you may put in the existing value proposition into that canvas as a starting point. Now the question kicks in: how to innovate that? How to come up with really a really new scope of innovation, and ultimately probably a new business model when looking at this value proposition that we have here. And this takes a shift in perspective. We need to have a different way to look at what we create for customers, and shift the perspective towards the job to be done. And that's jobs to be done thinking. And this is what I will like to introduce to you now, and how to use that for business model innovation. So it's not the drill, it's the hole in the wall. We do not want to look at the existing product that is in place at the moment, the existing value proposition that we have in place. We want to look at the underlying needs that are covered and that are addressed with existing solutions. Now, in the background of these jobs to be done philosophy, there is an extensive process, an innovation and strategy process called outcome-driven innovation. And it has a number of steps. These are 6 steps that you can see here. I will not go into all the details of that process. You can see that also in the handout and on our website. But I would like to drill down and boil it down to the major guiding questions that arise out of this approach when it comes to business model innovation. These are the guiding questions that I want to share with you. And the first guiding question is always, who is the customer? When we want to innovate, a value proposition, let's start off with the customer in mind. Who is the customer? The second question is, what are unmet customer needs? When we look at those customers, what are the needs? And are there probably different segments of customers with different kinds of needs? To then arrive at the third guiding question on designing and asking how to design a sustainable value proposition. When I talk about a sustainable value proposition, that means this should not be a value proposition for the next 6 months or for the next year to come. This should be a value proposition that will be the foundation of a business that will go on for years. So we need to come up with a value proposition that sticks and stands the test of time. And the question is how to achieve that. Now, let's go through these questions now one by one. The first question, who is the customer, might deliver a lot of discussions. And I take this example here, this medical device example here, the blood sugar meter business. And when you look at that business, and in any business, this is will be probably a similar thing, you see a lot of stakeholders. You see a lot of relevant people in such a business ecosystem. And in that case, we have diabetics, of course. These are the people who have diabetes, who need to use that blood sugar meter. But we can also see caregivers. We can also see educators that educate those diabetic people. We can see physicians. We can see insurance companies that have to pay for certain devices for those diabetics. And then we have even representatives from manufacturers of medical devices that, that maintain those devices and make sure everything runs and works. Now, there are a lot of people in that ecosystem, as we can see. Now, the question is, who is the customer? And typically, they are all relevant in a business. But what you can do to really zoom in on that customer that you should start with, and on that group of people that you should start with, is to ask yourself, why are we doing this at all? Why are we doing that business at all? And ultimately, this business of blood sugar meters is being done to help diabetics. And therefore, you may want to zoom in on that, so to say, ultimate executor or beneficiary of the business that you have in mind. Now, having said that, this does not mean that you should not consider all the others, but you should look at them probably step by step and one by one, and understand each needs separately. Now let's, make the first step and zoom in on the diabetics. And what we can see here is that these diabetics, what are they doing with that blood sugar meter? They use blood sugar meters and they measure their blood sugar with that blood sugar meter. Now, this would be, so to say, the first trap that we may jump in when we use jobs to be done thinking, that we look at the product, look at the service, and directly describe the job to be done based on what that product does. Yes, it measures blood sugar levels. But this is probably not the underlying need of that diabetic. So we probably shall, ask different questions here. We should not ask, what job does my product do? But we should ask, what job is the customer, the job executor, trying to get done? Why are they using such blood sugar meters? And when putting in this first question here, we will realize that there is something underlying, something behind using the blood sugar meter. People absolutely don't want blood sugar meters. What they want to achieve is to maintain their blood sugar level in a desired range. So that is why people are using such meters. And this is an analog example that we see in many industries. When you look at machinery engineering, when you look at processes in the industry, when you look at mobility, it's always about processes, and where people try, to get a job done, which typically goes well beyond the existing products that they use or the services that they use. Now, this would be the shift in perspective, trying to understand what is the underlying job to be done that, so to say, embraces that existing product if we have one. If we don't have a product in place already, if we, so to say, start totally from scratch, it would be the same thing. Try to understand what jobs are there that people are challenged with and find new solutions for it. Now, the right, so to say, market definition here would be that we want to look at diabetics who want to maintain blood sugar levels in a desired range. And that is a sustainable market definition, as this market definition will be stable over time, also for many years in the future. That will not change. What will probably and definitely will change are the devices, are the solutions that people use to get this job done. But ending up with a market definition that is jobs-based ensures that whatever we do and whatever kind of value proposition we will create in the business model, it will be sustainable and it will be valid for many years to come. Now, second question here is, what are the unmet customer needs? What we have found out here is, who are the customers that we want to create value for? Yes, and what is the job to be done? What is it that they want to achieve and want to do? But we still don't exactly know what the needs are, what the unmet needs are in achieving that job, in getting that job done. So we need to go a little bit further in our research, in our understanding of the customer needs. For that, we want to create a job map. Job map functions in a way that offerings naturally evolve over time to get the entire job done. And knowing what the entire job is establishes our long-term vision and accelerates the progress. Now, having said that, if you look at a job map, the job map structure, you can find that also in our publications, in the publications from Tony Alvig, and on our website. This is a very, very, I would say, simple template. It just consists of 8 elements, 8 steps. And every job to be done can be broken down and structured within these 8 steps. What these 8 steps describe is what the customer is trying to achieve when they run through a job, when they want to get a job done. What is it that they're trying to achieve typically? They want to define, locate, prepare, and so on. And I want to highlight that and illustrate that based on our blood sugar meter business, or not the blood sugar meter business as we have learned, the business about keeping blood sugar levels in a desired range. So diabetics need to run through these 8 logic steps, and they want to achieve each of them. They want to, first of all, be able to determine their specific therapy needs. They want to be able to understand alternative approaches to tackle their diabetic. They want to set up an individual therapy and an individual approach of a self-therapy, as this is something that a diabetic patient has to deal with on a daily basis. And this is not done by doctors, or this is a self-managed therapy that diabetics have to run through here. They are supported by doctors, and therefore, okay, we also saw them in the ecosystem. But this is really the job that the diabetic needs to run through on their own on a daily basis. They want to validate their therapy settings if they do everything right. Then they want to keep the blood sugar level in the desired range, monitoring the effectiveness of the therapy, adjust the therapy if needed, and keep track of the therapy adoptions. And that's how every process looks like when you describe it in an ideal way. In every process, in every job, you need to define something, understand what the objectives are, prepare for it, execute it, monitor the results, and at one point also conclude it. Now, why are we doing this? Why are we looking at this in that much detail? Because ultimately this describes how a business will develop in the future. because solutions tend to evolve to address each of the step of a job to be done. And that would then finally be the ultimate business vision, to come up with a solution platform that gets the whole job done better and cheaper. Now, what we can see here also is we can map existing solutions against that job to be done. And we can see how for example, our existing blood sugar meter addresses that job to be done. How much of the underlying job is being addressed with an existing solution in place, and how well does that work? Now, this is already a first insight and a first trigger to come up with a possible new value proposition in the future. What we also want to understand is, okay, what exactly are the opportunities? Now, when we understand that there is a job with many different steps and existing solutions are not addressing everything, we want to know what are the most important unmet needs the customer population has. And these needs are called the desired outcomes. These desired outcomes can be found in each of the steps of the job. So what we want to do is we want to drill down and ask people for each step of the job that they want to run through, how they want to improve that and how they measure their success. And this is typically just 3 questions to ask. We want to know where do people want to get faster in getting the job done? Which of the job steps takes a lot of time? We want to know where they want to be more predictable, where they want to have a more predictable result and less variability in getting the job done. And we also want to know where they are limited in their output or throughput. Because there are only 3 ways from a functional perspective to get a job done better: making it faster, more predictable, and with higher output or throughput. And I have an example on what kind of information you get when you put in that kind of questions towards diabetes patients, so real job executors. And you ask them, what costs you a lot of time when you want to determine your therapy needs? And you will get an answer like, I want to minimize the time it takes to assess at what time during the day blood sugar levels are frequently out of range. Now you can see this is a level of information that we get here that is extremely precise, that exactly tells us how to, how an improvement will be measured by a customer, and that is free of solutions. So also this kind of need statement will be valid over time. It will not change over the next few months or years. The need will be the same, the outcome will be the same, but probably we will see solutions that get it done better. Another example is when people want to validate the therapy settings, they want to minimize the likelihood of not being aware of the relations between diet, physical activities, and medication to keep the blood sugar level in the desired range. So you can see this already goes well beyond what the blood sugar meter can actually do for you. Yeah, and then when it comes to monitoring, people want to minimize the time it takes to determine the current blood sugar level. Now, this is an outcome statement and a need that is currently addressed with an existing blood sugar meter. And what we can do here is we can measure how well that existing solution actually addresses this underlying desired outcome. We can also measure how well competitive solutions can address it. And by doing so, we gain competitive intelligence, and we know where we stand at the moment, also when it comes to existing solutions. So what is an opportunity? Now that we know all the needs, now that we know there's 100 and more desired outcomes spread it all over this job to be done, we want to know what is really the opportunity, where to focus on, what should be the focus for innovation, for value creation. And an opportunity is an unmet need. That means it's a need that is a desired outcome that is very important and not very well served. Then it's an underserved need, or that is not important and extremely well served with existing solutions. In that case, we talk about an overserved need. And both are opportunities for innovation. Guess what? So this is how we measure it, and this is how we want to identify which needs opportunities. We put all the needs in a questionnaire, and we take, like this 100 need statements that we found, all the needs that are there related to a specific job to be done in a questionnaire, asking a representative sample of executors, in that case diabetics, about their evaluation and how important each of these outcomes is for them and how well it is served with existing solutions. So if we put in these 2 questions in a questionnaire, we get 2 dimensions. In this case, like all the outcomes. And we get two dimensions. These 2 dimensions can be seen in that opportunity landscape here. The landscape tells us a lot of things. All the dots inside of that landscape represent one desired outcome, one customer need. And they are evaluated by the whole population of customers, by at least a representative sample, according to importance on the horizontal line and satisfaction on the vertical line. So when we put all that together, we see that there are underserved needs that are very important and not very well served. This will call for innovation, of course, but we can also see overserved needs that are not important and pretty much served. Now here we may think of disruptive innovation approaches, getting that job done worse and same time way cheaper for customers who are overserved with certain needs. So probably we can reduce performance of existing solutions. We could create new solutions, maybe a blood sugar meter that is not as exact, that is not as performing as existing ones, but cost only, you can have it for free. And for those people, for those needs that are totally overserved. So what we can see here are the two sides of the innovation medal, like what needs to be improved and what might be disrupted and addressed with a way lower performance when it comes to addressing the needs. And once we have the data in place, we can also validate if there are different customer groups in a market. Typically, not all job executors are alike. And what we want to find out is, what are the hidden patterns in a market? Are there, so to say, larger groups of customers that have similar priorities when it comes to their needs, but that differ from other groups of customers? So we want to segment the market according to their hidden needs profiles. And that is a schematic example here, where we can see in that example that in that opportunity landscape, we see 3 groups of customers actually, and they have different answering patterns. Like the pink group of customers on the very right-hand side, they said that all of the needs they evaluated extremely important and not very well served, especially minimizing the time it takes to determine the current blood sugar level. This is 24% of the total population, that we realize here. On the other hand, we see a group of customers on the very left-hand side, the gray squares, that have a different answering pattern. And in their point of view, minimizing the time it takes to determine the current blood sugar level is not so important and extremely well served with existing solutions. So we realize that the market obviously has different groups of customers with different needs profiles and different priorities. And that is a very important input in our next step and in answering the final question, how to design a sustainable value proposition. Because most probably we need to come up with an alignment of our value proposition and products and services towards the different needs segments in the market. Getting back to our example, based on a deep understanding of true customer needs and segments, the value proposition can be designed now. And you can see here in that graphic that we started off in the beginning with the blood sugar meters. What we have learned now is on the right-hand side, we know who the customer is. We know what customer segments are there. We know what the underlying job is that the customers want to get done. They want to maintain blood sugar level in a desired range. We know how this job map looks like. We know all the needs related to that, and we have also quantified them and got priorities from a representative number of customers in the market. So we have a very, very good understanding now about who our customers are and what they really want to have. And when we go back now as a team in our organization, if you go back now to our value proposition that we have described in the beginning, our existing value proposition, we may put in a question mark here. We may validate if the existing value proposition is sufficient when looking at the job to be done of our customers or not. And in that case, we already saw that when we were looking at the job map, we saw that our value proposition based on that product that we took in here, for example, the blood sugar meter, is probably not covering the whole job to be done. And that leads us to a very clear-cut structure in working on a value proposition. The first question we put in here is, and we use the job map that we have in place, how can we get more of the job done on a single platform? So what would be a single platform solution looking like? What must it do to get the whole job done for the diabetic? And we know the whole job. We know all the steps that are involved here. So we can already envision a long-term business vision, a long-term value proposition that should ensure that we get more of the job done or all of the job done on a single solution platform. Solution platform can mean a bundle of hardware products, services, software products, a solution platform, a system approach. That is the first, so to say, the first line of thought. The second line of thought when it comes to creating a new value proposition is to ask, how can we get the job done and each of the steps of the job done better and cheaper? And that would be the point in time when we zoom in on the monitoring step in this example, like monitoring blood sugar levels, looking at all the outcomes that diabetics have, like they want to minimize the time it takes to identify their blood sugar levels, and recheck how well our existing solutions on the market, our own solutions and also competitive solutions, can already address all of these outcomes in that specific job step. And here, the question and the measure is to address those most important underserved needs better with existing solutions or new solutions that we need to create. So, and then there's the word cheaper. Who will make the race in the market if you deliver the highest value to the customer for the lowest cost to the customer? And this brings us then back to the whole business model discussion. We might discuss how well we can, serve the whole job, and same time, can we make it cheaper for the customer? Can we take out unnecessary cost, and can we, zoom in all the elements of the business model to discuss that? Now, that would be the basic line of thought and the major input that we get out of the job map and out of the needs for our value proposition discussion. Here we have the final, so to say, resolution, and what happened then for this medical device company. Actually, that was Roche. That we have been working with for many years now, and starting with this input on customer segments and unmet customer needs, a value proposition arose that took the job to be done as a stable, so to say, purpose that drives the long-term development of the company. And the headline here is, and you can read that on the website of Roche Diabetes. So I'm not telling anything that is not public, but this gives you a better understanding on how it came from. IPDM and integrated personalized diabetes management. That's the value proposition, personalized diabetes management. You remember, maintain blood sugar level in a desired range. This is something you need to manage. Apart from that, people also have other jobs, as you saw before, like they need to watch their diet, they need to watch their activities. These are other jobs, and they are all, so to say, related to this big umbrella managing diabetes. So if you take for a value proposition such an umbrella approach, where you can this will guide, so to say, product development, service development, and the whole business model development over many years to come, and serves as a purpose for your business. What we can also see here is some highlights on products that have been created. So it goes well beyond blood sugar meters. There are also insulin pumps out there that can, deliver insulin, because it's not only about measuring blood sugar, you also need to deliver medication, deliver insulin. You have an app here, that's the MySugar app. MySugar was a startup. It was a startup founded by Diabetics, and it is a kind of a notebook where you can track your whole therapy, where you can put in all your blood sugar values, where you can put in what kind of food you take in, where you can track your activities. You put everything inside, and this is a dashboard then that helps you to better control maintaining blood sugar level in a desired range and control your therapy and manage your diabetes. So this is where the app comes in. And guess what? It makes a difference to if you know what the underlying job is, if you know what's really not served, and then go out and find startups who can help you to exactly address the unmet needs. Instead of watching out, like having a look at many different kinds of startups and then picking one and try if they will come up with a success. So it's not a solution-first approach, it's a needs-first approach that really generates such long-term sustainable value propositions, and that can also be used as a basis for business case development. I would like to also zoom in now on these different elements of the value proposition and give you some ideas on what's happening once you are in the position to understand the job to be done that you want to create value for, come up with a holistic value proposition, in that case managing diabetes, and what the effects are. The effect is that you will instantly realize that you probably cannot address the whole job to be done, all the needs that are involved here, based on your existing competencies. So you will realize that if you want to address the whole job to be done, you need to build up competencies and capabilities in delivering all of these solutions. And this is the point where you understand what kind of key partners you should watch out for, what kind of M&A activities you want to proactively conduct. So what kind of startups you are actively searching for. So this is the key partner discussion and the key partner building block of a business model that will be very clearly guided and informed based on these insights on what the underlying needs really are. The patent development, what patents you want to work on, what kind of research you want to take, is also guided by that value proposition. You learn what key resources you need to build up, what key capabilities, what key research you need to do to be able to deliver that value proposition to your target customers. You will also learn what are the key activities that you need to come up with to make sure the value proposition can be delivered to the target customers. So, and we can go on like this. We can discuss cost structure. We can discuss how can we, deliver that value proposition for the right cost, for the right most efficient way to address the different segments in the market. As we know, there are customer segments that are totally underserved with existing solutions, who would probably be prepared to pay a little bit more to get the job done better and perfectly, while we see other customers in the market that are totally overserved with existing solutions. And here we would need to find a way to disrupt the existing offering and come up with a, so to say, low-cost service for those kind of customers. So a lot of insights that will be generated. And to come back to the first poll question, where should we start with innovation? What we found here, or what you were evaluating, like putting in startups and building an app, you see that's what happened then afterwards. But that was not the starting point. So and all of these decisions will be guided based on these insights. To sum this up, there is a testimonial from Roche, from Marco De Polo, who is head of portfolio strategy and global market insights. So you can see this is also in the Roche organization. Market insights, innovation research, and strategy are pretty much linked together. We had Marco De Polo also in our webinars already, in our masterclasses. There is a blog article and an interview with Marco that you can find on our website. And I want to invite you to, read through that, listen to that, and probably directly get in contact with Marco, who is also very open to share his experiences and share that. And that's my invitation to you, to stay strong as a community and to network. Now, I see that there is a lot of Q&A, a lot of questions coming in, and I would like to use the opportunity now to go into those questions. Okay. Let me have a look what I see here. So, a lot of stuff coming in. Do you do design thinking at all? So here we have one. Okay, I will go through that step by step now. How can I open that? Just a moment. Probably here. How can I pick that question? Here we have. Yeah, it's the first time that I use this Q&A mode. Yeah, any rules of thumb on how to calculate the statistical relevant number of respondents that are needed? Yeah, there is statistical tools and formulas that help you achieve a certain statistical validity. As a rule of thumb, not going into statistics now, as a rule of thumb, you may want to watch out for approximately 200 to 250 respondents to really have a very high statistical validity. But this always depends on the size of the total size of your market. If you have a, so to say, a very small market with not many executors, you will probably be off with less than that as well. We also have studies where we like investigate 1,000 different executors and customers worldwide to really get a very, very sound statistical basis for the decision making. What statistical software do you use? R. Yes, we also use R. We use SPSS, different tools. How do you operationalize the different customer groups in marketing? That's a good one. I like that. Now, when we have these different customer groups identified, we know them very closely. Not only know what their needs priorities are, so which needs they have, like prioritized and which are not well served for them. We also have profiling information, and you want to ask for these profiles when you carve out the questionnaire to the field. So that means we know in what context the job is being executed. We know many demographic information about those customers, and we need to make sure from the start that this can be linked back within an existing customer system, CRM system that an organization uses. So it's of course paramount and important to be able to link that back operationally for sales organization, for marketing organization, and so on. And finally you will end up with as we call it, a segmentation tool that everybody has in their hand when dealing with customers, and a salesperson can ask a customer when standing in front of them about certain contexts, about certain needs, where you know that this need is totally differently evaluated from different customer segments, and you just need to ask this one need and ask them, how important is that one for you? And depending on what answer you get, you can already put that customer in a certain group, in a certain segment, and then go ahead with a different value proposition, with different product offerings, and so on. This is also very well made and very well possible with digital channels, where you can already push people in different digital communication channels depending on what their needs really are. I see another one here. I see often that willingness to pay is an important factor for customers. How do you fit this in your model in an early stage? What is the value of the unmet need? Because that improves the success of the innovation. Also, I see you're all pretty much out of that space. And yes, I can confirm willingness to pay is important. We do this in a stepwise approach. The first way to deal with that is that when we ask people on their needs related to a job, when we ask them for all of their desired outcomes in a questionnaire, we also put in questions on like, would you be willing to pay more if you get the whole job done perfectly? And similar questions like that will give you an initial understanding if they would be prepared to pay more if it would get done perfectly. And how much people would be prepared or willing to pay more in more detail can be tested once you have created the value proposition, created a prototype, a minimum viable product, and then test different product versions against the willingness to pay. So that is, so to say, then the second step in the innovation process. But first of all, it's possible to ask people just bluntly, if you would address that, would you be willing to pay more to get it done perfectly? Okay. How can this process be optimized to fast-moving consumer products? A skincare product, I mean, can this process, especially the need statements, be reduced? Yeah, so for the first part, definitely. We have been working for one of the leading skincare companies in Europe, or if not worldwide. And we were looking at different jobs that people have when it comes to their skincare. One job to be done was to remove unwanted body hair. And probably many different products pop up in your mind now. And we were also looking at a job of preventing unwanted body odor. So you can see, you can frame job statements around products, but with the intention to understand what's happening behind, what is the underlying need, and yeah, can this process, the need statements be reduced? We use the language that people use. What I was presenting is how these need statements are structured. And depending on the complexity of the job, need statements can be more exhaustive or more condensed, but this is then to be discussed and to be looked at when you dive into the language of the customers. At least the basic structure should be kept, like what should be optimized, the time it takes, the likelihood that something goes wrong, or the likelihood that your outcomes are restricted. This would be, so to say, the core element of the outcome statements. How about digital sales when you cannot ask the customer? Okay, I think this goes back to how can I understand if a customer is in segment 1, 2, or 3? Ask them digitally. When you have a website in place and a landing page, you may ask a customer, do you have this need or that need or that need? So you can put that into the digital communication and put that into keywords and search engine optimization. So there are different ways to use that insights and that understanding of hidden customer needs in the communication, not only personally, but especially in a digital space. I'm happy to go into this more closely if you like. Is there more information about different case studies online? Yes, there is. I already mentioned that. Please just have a look at the website. There are many different case studies from different industries, especially automotive mobility industry, where exactly this same kind of case was executed. There was even a joint venture founded by a large automotive manufacturer to get a different job done, and that was arriving on time in an urban environment. You can see that job, you can see that case study on our website, and yeah, we have examples from logistics, we have examples from cooling transportation on trucks, we have examples from machinery engineering, paper machines, different applications. And it always boils down to the same thing: what is the job to be done, and how can we better understand that? How do you acquire the job executors for the quantitative part of job to be done? Yeah, that's an acquisition work. You're right. How to acquire them? There are basically two ways to do that. The most easy one is if you just have an online questionnaire and not use all of the outcomes, all of the needs that you have found in the market, but like strip down these needs statements to a bunch of, let me say, 30 statements, not more than that, that you can run through with a 15-minute questionnaire in an online version. So this is rather easy to acquire people to join you in such a quick online questionnaire, and this costs not so much money. How do you acquire them? Probably sending it out to your own customer base and using your existing network of customers to conduct a quick research. On the other hand, if you really want to inform a long-term strategic decision, and if you want to come up with a long-term sustainable value proposition, it is really advised to put in all the needs that you have found in the market, which is approximately 100. And such a questionnaire will take an hour to fill in. And you need to guide those customers through that questionnaire and do that together with them. We use different designs to do that. In that case, you just need to typically give people an incentive to join you for an hour and pay for their time and take this as an investment. And it's possible to acquire all these people with field agencies that are out there, and we can give also recommendations for recommended field agencies that can support such an approach. Another one that I would like to go into: customer or user or both. Yeah. Well, who is the customer and who is the user? I would suggest to watch and to zoom in on the job executor. So who is actually executing a job to be done that you are trying to support with your product or service, with your value proposition? So that's the ultimate unit of analysis, in this case, the user. So the person who is actually trying to execute a job. That is not necessarily the person who buys your product. That would be the buyer, or if you would say the customer. And you want to differentiate these two roles in your business ecosystem. Ultimately, you want to start off with the job executor, with the user, understand what's really the job that they want to get done, and to be informed about what could your value proposition look like. And then, if you are in a business where purchasing decisions are taken by different people, you may want to talk to those different people as well and better understand the purchasing job and what the financial and commercial outcomes are that these people want to achieve. And then you put together both worlds and condense it into a business model that gets the whole job done for all of these executors in your ecosystem. Yeah, do you do design thinking at all? I would say that's part of our DNA. We are working with this framework for more than 25 years now. So it was the whole framework, jobs to be done and outcome-driven innovation, was born together with the beginning of the digitalization era. It was born within IBM in the early 90s. And Tony Alvik was part of a product development team. They brought to market the junior PC, and it was a big flop. And that was the point in time when they said, okay, how can we ensure to create the right stuff, to create exactly those products that exactly address customer needs? And that was the birthplace of outcome-driven innovation and jobs to be done. And ever since, it was developed further and further. And I think design thinking is exactly the same philosophy that you follow here. It is, so to say, design thinking has a very strong focus on creating the design, doing the design, while jobs to be done and outcome-driven innovation has probably a stronger focus on the early stage of it to understand the field of play and quantify that. But I would not say that, it always depends on how you approach it and how you do it. It is pretty much similar, I would say. Is testing time some kind of application? I'm not sure if I understood your message. Testing time. I am not sure if I understood the question. Is testing time some kind of application? I'm not sure if I know. Okay. Yeah, when it comes to understand the blood sugar level or minimize the time it takes to identify the blood sugar level at a certain point of time, I definitely, if that was the question, I'm not sure if that was the question, but when I look at the outcome statement that I mentioned beforehand, it is no. I think testing time means. I think I understand now. Testing time means the value proposition will be valid for many years to come. I would like to close off the session here and with a short summary, that we already had now during the Q&A. I think you get this also as a handout, and I would like to invite you to join in a community within the Job to be Done Institute. Here is the program for the whole year. We have many online formats where we are happy to have you there and exchange your thoughts. There's an e-learning out there where you can learn how to apply that way of thinking on your own. And let me say a special invitation to our second Jobs to be Done Summit Europe that will happen in March 24 to 25 in a hybrid version in Vienna and online. And we will have there many leading innovators from throughout the world that you can join there. And we wanna like connect you with all of these great minds, and join the community, come there and be part of the Jobs to be Done community. So I hope this gave you inspiration for tackling your question on how to innovate your business. And stay tuned, stay healthy, and keep joined. Keep us. Let us be together for the next time, and join our next formats. Thank you very much. Goodbye.